Hello, my name is Jonathan Hewitt. This is the rehabilitation portion of my presentation on patellofemoral syndrome. We're just going to go over a few exercises for rehabilitation. They can also be used as prevention if you come in with somebody that may have some biomechanical factors that you want to address as well. If I'm looking at someone with PFS, we already know that they are dealing with some increased friction in that area. So we want to start somewhere that's actually not so painful, okay? So I tend to do things that are single leg in nature. One of the activities I would have them do, starting out with a single leg squat, first of all, just to see if they can. Assuming they can with minimal pain or no pain, then I would start there as an exercise. Single leg squat is going to look something like this. So hands overhead, you're going to go down, touch the floor, come right back up, have them do several sets of that if they can tolerate it. Another thing I'm going to consider when we're doing some rehab exercises for the lower body in regard to PFS is which plane of movement are they least painful. For example, if this, in the sagittal plane they are very painful, I'm going to stay away from some certain activities. So, for example, I would not have them do a single leg heel touch in the sagittal plane to the front. It's a lot of stress on the knee. I'm going to avoid that from the get-go. What I may do, start off in the frontal plane, do a toe touch laterally. That way I'm working on strengthening the hip, the knee, working on neuromuscular facilitation as well. And I'm staying away from increasing force in the anterior part of the knee where they're having some issues. Okay. Another thing I may try is something in the transverse plane. That kind of will bridge the gap between frontal plane and sagittal plane with an activity I like to call, let's call it half moon. So we'll start here, we'll go out to the side, we'll go back, to the front, to the back, to the front. As you can see, when I go to the front, I'm actually in the position where I want to be for that anterior toe touch, okay? So I'm going to get here for the anterior toe touch once they're pain-free, okay? Go back and forth like that. Only am I going to introduce that when they are pain-free in the other two planes. And I may even start them out nice and simple here, not going out too far. Working their way up to something like that where they're going out a little bit further. Okay. Some other activities that you may want to address the knee with. Leg extensions has shown to help with this, especially if you have lateral translation of the patella. Working on the VMO here will assist in pulling the kneecap back around a little bit, and neuromuscularly, actually I should say neurologically, it will help with the timing of muscle contractions. Some studies have shown that by working on VMO strengthening, it will initiate the VMO a little earlier as compared to the vastus lateralis, which is here, and thus help pull the kneecap back around. With vastus lateralis initiating earlier than the VMO, that tends to pull the kneecap laterally a little bit more, and you get a little bit more knee pain there. So those are just a few exercises that you can do to help with PFS. And there's many more out there. There's a whole gamut of things out there, but those are some areas I like to start with when I do some rehabilitation. It's something easy that a coach could facilitate as well.